Hey there. My name is Dr. Cozy. It's really nice to meet you. And I see that we have you here today because you've been having some back pain. Okay. Was this an injury or did this kind of creep up on you? Okay. And is it any specific region of the back or kind of everywhere? Okay. Are there any movements in particular that seem to make it worse than others? Okay. And, sorry, is it okay if I poke and prod? Thank you. Would you describe this as sharp, dull, kind of throbbing, prickly, burning? Okay. Any burning, or I'm sorry, any numbness or tingling in your toes or fingers? Okay. And any stiffness with turning your head? Okay. Would it be okay with you if I turned your head and kind of got an idea about your range of motion? Okay. I promise we'll go nice and slowly. And if at any point it feels like it's too much, it's too intense, let me know. So, I'm just going to put my fingers on either side. We're going to start. How was that? Okay, I'm going to try it one more time, okay? Still okay? Okay. So, just feeling for something called hypertonicity, which happens often when a muscle has been used a lot. It can make the muscle feel kind of full and firm. Any pain in any of these areas? Okay. Just checking, because oftentimes when it comes to back pain and spinal injuries, we can actually see that pain expressed in other areas of the body due to the extensive branches of nerves that come from the spine. So it's always something that we like to rule out because nerve pain can be really disruptive. But you're not feeling pain in any of these areas? Okay. Okay. So, first thing I'd like to do is check some symmetry. This can help me determine whether or not there are any muscles in particular compensating for the injury, and being able to identify that can help us and prevent further injury from occurring. So, I'm going to start just with a ruler, and depending on the area, if I find a spot where I might be able to make a little tweak, a little adjustment, I have this activator here which can kind of gently nudge joints back into better alignment. It's not painful, just maybe a little bit of pressure. But the first thing I want to do is measure from your ear to your shoulder on each side. And that can help me determine whether or not we have some cervical tightness occurring. So okay. Okay. So it looks as though your left shoulder is actually just a little bit higher. Put this now across. So those adjustments I spoke about, I'm going to do some right now. I'm going to use my tailor tape to do the remaining. So now we're going to do from the humeral head down to the tip of your middle finger, okay? So now I'm going to do right here, so at the corner of your mandible, right under your ear, down to your hips, to each hip. So this side. much better. Okay. So I'm gonna have you lie back, okay? Facing down, so lying on your tummy. And what I'm going to do is I'm going to use an algometer to determine which areas are experiencing pain on your back. I think you're a good candidate for something called pulse stimulation, where I will be applying or attaching some electrodes to those particular areas on your back, and then delivering some low-level electrical pulses to help and stimulate the muscles and encourage healing. Afterwards, I will give you an ice pack to help and reduce any inflammation that may be caused, and then we'd have you come back a week later and repeat the process. And I've had a very good track record. This has shown to have a lot of great efficacy with patients who are dealing with back pain, especially people who have been dealing with it long term. It can be very disruptive, so it's really important to get ahead of it. So, quick question. Do you have a pacemaker? Okay, good. Just need to rule that out. So if you want to go ahead and lie down on your tummy, and I can help you get adjusted. Okay. Are you okay lying down like this? Okay. So I have something here called an algometer, which is going to help us and track where you're feeling pain on the back as well as what degree. And anywhere where we're experiencing pain, I'm going to mark. So we're going to start in the lumbar region. So pain. How about here? Pain. Okay. Pain. And here. Okay. Pain. 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 Okay. So one over here. Pain. 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 Okay. So from here, 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 and here, in these two areas. Are there any other regions that you're feeling? Okay. These on your bone there. Clean this off. Okay, so in just a moment I'm going to turn the device on, and to begin with it's going to just be like a low level tickling, kind of a buzzing sensation on the skin. I will gradually increase the intensity, and it shouldn't be painful. It might be a little bit ticklish. If at any point it gets to be too intense, let me know. We're going to start at a 2. You doing okay? Okay. I'm going to gradually increase the rate. Okay. Still doing okay? Okay. A little more. You should start feeling it more actively in the electrodes. Okay, good. All right, now we're at our final strength. All right, and that's it. I'm going to slowly decrease this down. And we can turn that off. I'm going to go ahead and remove these. This one might be spicy. Okay. I'm going to go ahead and remove the residual eyeliner. Okay. And then I'm going to apply some magnesium oil. And I'm just going to very lightly massage it in. I'm not going to do any kind of deep tissue work because we don't want to cause any undue trauma here. But it definitely absorbs better with some massage. Is that okay, pressure? We're not going to do more than that because I don't want to cause any more trauma to the muscles, but let me just get a cloth. All right, and take your time sitting up, okay? Okay. So how are you feeling? It's a bit intense, yes? Yes, but good or bad? Okay then. So really quickly, I'm just going to take one more set of measurements. I'll start again with your ears to your hips. Okay. The other side. Good. And now the length of your arms. And check the symmetry visually of your shoulders. So, good. And now your neck. Looking good. All right. Put that back. So now what I'm going to do is give you an ice pack. And you are welcome to stay in here for as long as you'd like. Oops. With the ice pack, let me just wrap it. Okay. I'm gonna kind of tuck this around here. And then I'm actually going to use a little piece of tape to hold it, so that way you can be hands-free. Okay, so then my chart here. Okay, so like like I said, I would like you to return to clinic in a week so that way we can repeat the procedure as well as assess how you're doing. So, let me just pull up my schedule here. Okay. So, did you want to do the same day? This day works for you? Okay. I do have the same time slot available if you'd like to take that. Okay. Okay. I got you in, and you should receive a text message to confirm. We do request 24 hours notice for cancellations. Less than that will result in a cancellation fee of $25. So really appreciate it if you would give us notice. I'm gonna let you sit here in the room for a while, for as long as you need with the ice, okay? And if you need anything while you're in here, go ahead, and there's a little doorbell on the wall. You can go ahead and press it and someone will come in and help you. Okay. In the meantime, I recommend continuing using ice at home. All right. Do not stay immobile. One of the mistakes that a lot of people make when it comes to injuries, particularly with the back, is spending time lying on the couch, lying down. There's a reason why Aristotle said walking is good medicine. Sorry, I have a little bit of a stutter and sometimes it comes out. But anyway, walking is good medicine, and it's particularly true when it comes to your back. After you get to a point where you're able to walk, I would say for 15 minutes without pain, then I think we're ready to get you started on some physical therapy. All right? Okay. But in the meantime, one thing at a time. So trying to walk a little bit, a few times a day. Anti-inflammatories as needed. Ice. And just taking it easy and staying in tune with your body are really going to help you. All right? Okay. Do you have any questions for me? Okay. Well, if you think of anything, feel free to give me a call, all right? All right. I'll see you back next week.